Medical expertise should not be limited by geography. That is the promise of teleradiology. This technology is so powerful, it provides diagnoses during disaster relief when local infrastructure fails. How is this possible? Because teleradiology delivers expert interpretations in minutes, a vital factor in an emergency. But its impact extends beyond disasters, solving daily healthcare problems of access and expertise. We'll break down the core technology and reveal an advanced application that is changing patient safety. The first problem is access. A small rural hospital cannot have every type of radiology specialist on staff. Teleradiology bridges this gap, connecting that hospital to a pediatric neuroradiology subspecialist miles away. The second problem is workload. On-site radiologists face immense pressure from a relentless demand for reads. These services handle overflow and after-hours coverage, allowing on-site teams to maintain a healthier work-life balance. So, it solves for both access and workload. But what technology makes this connection possible? The process starts with a digital image from an MRI or CT scanner, stored using a system called PACS. Using high-speed encrypted internet, the image file is sent from the hospital's PACS to the teleradiologist. It involves integration with electronic health records to give the radiologist needed patient context. All data transmission must comply with strict privacy laws like HIPAA, protecting patient information. Modern platforms now embed AI tools that can triage cases or highlight potential abnormalities for review. This pipeline gets the right expert to interpret an image. But what about procedures needing more than an interpretation? For example, scans using contrast dye require careful supervision. How can teleradiology possibly handle that? The answer extends the radiologist's presence back into the imaging suite. The virtual contrast supervisor. This is a qualified radiologist or physician assistant who remotely supervises the IV contrast administration. They ensure the right dosage is used and monitor for adverse reactions, speaking with the tech and patient in real time. This system solves a major logistical problem. A single supervisor can standardize contrast protocols across many centers. This is active remote procedural oversight, improving both safety and quality, and marks an evolution in patient care. How is it cost-effective? The value comes from economies of scale. One central team can serve dozens of hospitals. The model is so effective it's expanding beyond human medicine into veterinary teleradiology for pets and zoo animals. It is also worth noting the difference between reads. Many services provide fast preliminary reads overnight. We've seen the benefits, the technology, and advanced applications. So what does this mean when put together? The power of teleradiology isn't in one feature, but in how they combine to create a greater capability. That rural hospital can now get a subspecialist read and perform advanced contrast scans with remote expert oversight. Back in the disaster zone, that speed means a trauma scan gets read in minutes, guiding surgeons and saving lives. It has matured from a remote reading service to a platform for distributing medical expertise and oversight anywhere. The virtual contrast supervisor is the perfect example of this evolution into an active, integrated part of patient care. We've seen how teleradiology addresses access and burnout, and how virtual supervision elevates patient safety. The future will likely see deeper AI integration and remote specialists guiding robotic-assisted procedures. Ultimately, it is about one thing: delivering the best possible care, no matter the location of the patient or the doctor. For leaders, it is time to look into these platforms. For patients, it's a reason for confidence in medical imaging.